For many people, childhood means school, friends, and favorite activities. But for one Northeast Ohio teenager, it also meant doctor visits, exhaustion, and the loneliness of living with a disease most people had never heard of. Senior health correspondent Monica Robbins is in Studio B this morning with more on this amazing young woman.
Yeah, Danita, thank you so much. April is Sarcoidosis Awareness Month, and I have two very special guests. Scarlett Washlock was diagnosed with this rare inflammatory condition at just 12 years old, and now she's turning that experience into advocacy, and Dr. Manuel Ribeiro is her sarcoidosis specialist at Cleveland Clinic. Welcome, both of you.
Thank you, Monica.
Thank you.
All right, you were diagnosed at 12. Oh my goodness, what was that like? And kind of explain to the rest of us what it is.
Well, being diagnosed with sarcoidosis when I was 12 was extremely hard. It's been an emotional journey, and it still is. It's just been very difficult because I was 12, I was doing different things than my siblings. I couldn't do what they were doing. I just wanted to sleep all the time. I was missing school. I remember asking my parents if I was going to die when I got diagnosed. It was hard.
Is it normal for 12-year-olds to be diagnosed with this?
It's very unusual, Monica, very unusual. It happens, right? But yeah, it's definitely more common in older folks, absolutely.
So explain to us, what is it and how does it happen?
Yeah, so it's a disease, Monica, that causes a lot of inflammation in the body. So the immune system of somebody with sarcoidosis is hyperactive. A lot of cells from the immune system, they form a little cluster called granulomas. We can only see that under the microscope. But then depending on where those granulomas are, lungs, skin, joints, patients can start to have a lot of symptoms. And absolutely, like Scarlett mentioned, extremely affecting their quality of life.
Is it related to other autoimmune diseases or, you know?
That's a great point. So it's not exactly an autoimmune disease, but there is an overlap. So patients with sarcoidosis, they can have a higher risk of having other autoimmune diseases. In sarcoidosis, we don't know exactly what happens, but we believe that it's a reaction to something external, some type of exposure in the environment that we still don't know what it is.
So how did this impact you in your childhood?
It was just so much pain, so much worry. I was scared. I remember just being so sad, but I eventually found the Foundation for Sarcoidosis Research and Dr. Ribeiro here at the Cleveland Clinic, and that's when I was able to really open up about my journey and what I've been through, and use those sources to embrace my disease and start advocating.
So what was treatment for you?
Treatment started with prednisone, and then it moved to methotrexate, and then it moved to Humira and other drugs such as hydroxychloroquine and folic acid, things like that. I've been on treatment pretty straight for about 6 years.
So you mentioned advocacy, and I'm very interested in that because you just went to D.C.
Yes.
What did you go there for and why?
So I went to Washington, D.C. for a Rare Disease Week on Capitol Hill. So we went to Ohio's Congress people's offices, and we just sat down, talked to them about things that need to change, the legislative asks, and I've never met so many compassionate people. There were so many people like me there, and really, we need our legislators to listen to our rare disease asks because that's where the real change is made from.
So what did you learn from that coming back? Because you are finishing your freshman year at Ohio State.
Yeah, I learned that I'm gonna keep going and advocating, and we need more people for any rare disease that you have. If you know someone with a rare disease or you have one, advocate for yourself because it's very important and it makes change.
What do you want to see with your particular illness? What do you want to see change?
I want a approved treatment, and I just want people to not look at me like I'm crazy when I say that I have these symptoms that they can't see, because I look like a perfect 19-year-old, but inside I do have pain and fatigue, and I've been through a lot.
Dr. Oberria, talk to me about treatment. Is there anything new on the horizon that, she's hoping for?
Yeah, so I think there's definitely a few new things. So one of the medications that Scarlett mentioned, the adalimumab, it's actually one of those biologics, like new class of medications that are more specific to one little molecule called TNF blocker. So this is a great thing that we can offer to patients nowadays. But Scarlett is absolutely right. It's not FDA approved. It's off-label, so it's hard to get it approved for patients. So we need to develop new drugs, get them FDA approved, so they'll be easier for patients to get.
Are there symptoms of this that people could have and they have no idea that they are dealing with this?
Absolutely. So it's such a rare disease that not everybody is familiar with it. So symptoms that patients with sarcoidosis can have, for example, chronic cough or chronic joint ache or skin rash. They're common in other diseases, so it's common for healthcare providers and even patients to think that they have something else, but they actually have sarcoidosis. So one of the main recommendations is if patient is struggling with a symptom that nobody can explain, especially after 3 months, it's important to think about sarcoidosis and discuss this with your healthcare provider.
Great advice and great work. And I have a feeling you're going to be a doctor someday. All right, Danita, back to you.